Hello everybody. In this video we're going to talk about the cranial nerves. 12 pairs, maybe 13 depending on how you count, but these are nerves that go to and from the brain. Most of them are considered to be part of the somatic nervous system, the sensory, the afferent division of the somatic nervous system. But cranial nerves 1 and 2 are actually considered to be part of the central nervous system. So what we're going to do is we're going to talk about the nervous system, I'm sorry, the cranial nerves, and you're going to memorize them. All right, so this might be a good flashcard kind of study event because I'm going to want you to know the numbers, their names, what they do, and whether they're sensory, motor, or both. So sensory are going to be ones carrying sensory information like about vision or hearing into the brain. The motor ones go out for movement, and some are both sensory and motor components. So let's just start. We're going to start with cranial nerve 0. They call this one cranial nerve 0 because it was discovered in 1913, yeah, long after they discovered the other 12 cranial nerves. And the reason it took a while to discover this one, it's a very thin nerve. And so a lot of times they either overlooked it or they scraped it away as they were doing a dissection. But they believe that cranial nerve 0 is for detection of pheromones, those chemicals that give information about body. And in most animals, they're detected in a part of the brain called the vomeronasal organ, not in the olfactory bulb. But they're quite controversial in humans, whether humans have them. I believe we do detect pheromones because we are animals and other animals do. But I'm just going to mention cranial nerve 0, which is for pheromones. It's both sensory and motor. And then let's move on to the rest. All right. I will give you a number of mnemonics after we're done, but I will want you to learn the number, the name, whether it's sensory, motor, or both, what its function is, and what happens when there's damage. And you'll know what happens with damage because it's the opposite of what its function is. So cranial nerve number 1 is called the olfactory nerve. It's only sensory. It's for the sensation of smell. It's going to become the olfactory bulb. Go to the olfactory bulb and then become the olfactory tract. This is considered part of the central nervous system. This is an interesting one. It goes right to the hypothalamus without first going through the thalamus, but this is for the detection of smell. So if you don't have it, if you have damage to the olfactory nerve, anosmia means you can't smell. People with anosmia have trouble with their memory because smell is strongly tied with memory, real strong connections to the hippocampus. And a lot of them have trouble falling in love. So cranial nerve number 1 for smell. Cranial nerve number 2 is the optic nerve. It's a big nerve, very large fibers, like 1 million neurons. And this is also only sensory. It's carrying information about vision or sight from the retina, and it goes back to the occipital lobe. And if you have damage to this, there's different ways it could be damaged, and it could be anopsia. And there's a page on this in your human brain coloring book if you could see the different forms of damage and what they can do. But fairly simple, cranial nerve 2, optic nerve for vision. And one way you can remember this, cranial nerve number 1, there's only one nose. It's for for olfactory, for smelling. Cranial nerve 2, you have 2 eyes for vision. Cranial nerve number 3 is called the oculomotor. And good, the name is right there. This is a motor only. This is for movement. So cranial nerve 3, ocular motor nerve, this is for eye movements. It's going to innervate 4 of the 6 eye muscles. And I will not have you memorize. You don't have to remember specifically which movement it is. It's to follow objects up, down, and diagonal, but you do not have to know that. So just know it is for movement of the eyeball. But I do want you to know it's also, so don't worry about which movements, but it is moving the eyeball. And it's for accommodation for near vision. All right, so our lens changes shape, which we'll talk about later in the semester, when you want to look at something near or something far. And the ocular motor nerve helps change the shape of the lens so you accommodate your vision for looking at something near or for something far. You change the shape of your lens. Ocular motor nerve also helps the pupils constrict and it lifts the eyelid. So damage is going to be the opposite. Damage, you're going to have ptosis. That's going to be lid lag. Your eyelid is going to be droopy. You lose the ability to accommodate for near vision. You lose that pupillary reflex, and you lose some specific eye movements. So that's the ocular motor nerve, and it's only movement. There's not a sensory component to that. Cranial nerve number 4 is called the trochlear nerve, and that's also motor. It's also for eye movements. And don't worry about which eye movements. It's, specifically, basically, if you don't have it, you can't rotate your eye down and out. Don't worry about that. But it's eye movements of the eyeball, and with damage, you'll lose specific eye movements and have some double vision. Cranial nerve number 5 is the trigeminal nerve. This is a very large nerve, a lot of big branches, and it is sensory and motor. So it's both sensory and motor. So on a test, I'm already going to tell you, I'm going to give you specific, like I'll give you a number, and you have to tell me what its name is, and you have to tell me if it's sensory, motor, or both. And if it's both, you have to tell me the sensory component and the motor component. So trigeminal nerve. They call this sometimes the dentist nerve. And any pre-dental students, you're going to spend a lot of time talking about the trigeminal nerve. This is the sensory component. It's going to be sensations of the face and nose and mouth. So you could see why dentists care about that as you're poking around in the mouth. The motor activity, this helps mastication, which is chewing. All right, so it helps with mastication. Tic-douloureux. Tic-douloureux is also called trigeminal neuralgia, and it's considered to be extremely painful. All right, that is just damage or some kind of lesion to trigeminal nerve can cause intense pain in this nerve that goes to your face and nose and mouth. It's very sensitive. So trigeminal neuralgia or tic-douloureux can be damage to the trigeminal nerve. And parts of the trigeminal nerve go up near the optic nerve. And there's something called a photic sneeze. All right, photic sneeze. Let me see if I can write. I have trouble writing. Always make the thing go away. What a photic sneeze is, do any of you ever sneeze when you go out into daylight? So if you've been inside and it's dark and you go out into the sun, you just sneeze a whole bunch. That is not uncommon, and it's called photic sneeze, but the abbreviation is, let's see if I can, no, oh damn. Here we go. Give me a pen. There we go, pen. It's autosomal dominant, compelling, helio-ophthalmic outburst syndrome. All right, autosomal dominant, compelling, helio means the sun, helio-ophthalmic outburst syndrome is what they call photic sneeze. And it's quite common. Up to 30% of people will do it. So it's connected to the trigeminal nerve. Alrighty. Come on, next. There we go. Cranial nerve number 6 is the abducens nerve, and that is also only motor, and again for eye movements. And don't worry about specifically which eye movements, but if you do have lesion there, you can be cross-eyed. So I want to point out 3, 4, and 6 go together. Cranial nerves 3, 4, and 6 are all for eye movements. Cranial nerve number 7 is the facial nerve. And this is both sensory and motor. The sensory part of it is for the sensation of taste in the anterior 2/3 of your tongue. So it's a lot of sweet, but so it's taste on the front of your tongue. The motor component is for muscles of facial expression and stapedius muscle as well. Stapedius muscle is in your middle ear, and it helps protect against really loud sounds, and salivary gland secretion. So the motor component of the facial nerves makes you secrete saliva, have facial expressions, and the sensory component is taste from the front of your tongue. And damage can lead to Bell's palsy. And later in the semester, we'll do a neurological exam, and I'll talk more about Bell's palsy, but basically you lose on one side of your face. It's damage to the cranial nerve 7, so you lose facial expression. So you can't smile on that side. You can't completely close your eye on that side. And it usually goes away within a year, but I will talk about that later in the semester. Cranial nerve number 8 has a lot of names, all right? So one, it's called acoustic nerve. It's also called the auditory nerve, and it's called the vestibulocochlear nerve. Vestibulocochlear nerve, and that's actually the most accurate. But the acoustic or auditory nerve is sensory only, and that carries signals from the hearing. So that is for sensation of sounds. If you have damage for this one, you have nerve deafness. You can't hear. You may have dizziness, loss of balance, nausea and vomiting, because it's inner ear that not only controls hearing, but it's the vestibulocochlear part. That's the part that the vestibular part is your vestibular system of, am I spinning? You might feel like you're spinning, or where are you moving in space? So damage to cranial nerve 8 can be damage to hearing and your sensation of where your body is in space. Okay, we're getting there. Cranial nerve 9 is called the glossopharyngeal nerve. And this is both sensory and motor. The sensory component to this one is taste from the back of your tongue, the posterior 1/3 of your tongue, and also taste in your pharynx or your throat. So this is taste. And the motor component is against salivary glands and swallowing, the muscles of your pharynx, so that help control with the swallowing. This is a parasympathetic nerve. So it was 7, 3, 7, 9, and 10 are all parasympathetic. So glossopharyngeal, cranial nerve 9 is both sensory and motor. Sensory is going to be taste from the back of your tongue and sensation from the back of your tongue as well. And the motor is saliva, secretion of saliva, and swallowing. Damage to it, you're going to lose swallowing. You'll lose your gag reflex. You can lose the taste of bitter, because bitter is mostly in the back of your tongue. Okay, 3 more. Vagus nerve. Vagus nerve is a biggie, and there's a whole bunch of research going on in the vagus nerve now. It's very important. Vagus nerve now is very long. It travels. It's from the root of vagabond. It is both sensory and motor, and it's going to be sensory signals and motor signals back and forth to the pharynx, the larynx, the chest, the gut. It's parasympathetic, and it's going to, like, for instance, send signals down to increase secretion from the stomach. It's going to send signals down to slow your heart rate. So it's very, very important. So it goes to your heart, your lungs, your stomach, your pancreas. And it turns out it also plays a role in inflammation and immunity, whole bunch of things. Now, most of the nerves, 80% of the fibers of the vagus nerve carry information from the body up to the brain. And only about 20% is what we used to focus on. 20% carry signals from the brain to the body to slow down the heart, to increase GI. But actually, most fibers go back to the brain and carry information, and your brain adjusts for that. And they're looking into stimulation of the vagus nerve as possible treatment for rheumatoid arthritis, heart failure, diabetes, hiccups, uncontrollable hiccups might be related to the vagus, epilepsy, depression even. So there's a lot of research in the vagus nerve. 2 more. Cranial nerve 11 is the spinal accessory nerve. It is motor only, and this is going to go to the big muscles of the neck, the sternocleidomastoid. Now, if you took anatomy, you remember, so pretend you're praying, bow your head down, that's sternocleidomastoid, or tilt your head left to right so your ear goes through towards your shoulder, that's sternocleidomastoid. Now, shrug your shoulders up. Shrugging up, it's going to be trapezius. All right, so spinal accessory nerve, the motor nerve, cranial nerve 11, controls those movements. And so damage to those, you're going to either have decreased strength or lose the ability to make those movements. Finally, the hypoglossal nerve, cranial nerve number 12, is only motor, and that's for muscles of the tongue. So damage with this is going to be problems with swallowing and some speaking too, because tongue is involved with that. the tongue will look asymmetrical because usually you have damage only on one side. So it might be all wrinkled up on one side, or it'll look different, but that's going to be damage on one side of the tongue. Now let me give you some mnemonics. Here's the classic one that everyone learns in grad school and med school, and they will teach you this. On old Olympus towering tops, a Finn and German view some hops. All right. And each of the first letters begin with the cranial nerve. So olfactory, optic, ocular motor, trochlear, trigeminal, abducens, facial, auditory, glossopharyngeal, vagus, spinal accessory, hypoglossal. So that's one way. There's another one. Old Opie occasionally tries trigonometry and feels very gloomy, vague, and hypoactive. Now the advantage of this one is it gives more letters, because look, we got 3 O's. O. How do you know which one is an O? So this one's olfactory, optic, oculomotor. We got a couple T's. This one's trigeminal, trochlear. Okay, trigeminal. Let's say facial. What do we got? Glossopharyngeal, the vagus. This is number 8. They're going with vestibulocochlear, accessory, and hypoglossal. Now this is what I learned in grad school. You may learn this one in grad school. If you don't like this one, just don't use it and click on through. But it's the one I remember. To touch and feel a girl's vagina so hot. If you don't like it, don't use it. But that one I also learned in grad school. So find a mnemonic that works for you and use that one. All right, now how to remember if it's sensory, motor, or both. And the mnemonic here is some say marry money, but my brother says bad boys marry money. So if I were to ask you, is cranial nerve number 7 sensory, motor, or both? Some say marry money, but my brother, both. So cranial nerve number 7, 1, 2, 3, 4, 5, 6, 7 is B for both. How about number 3? Motor, M for motor only. So you can use that just to count it through. And then if we were in class, we'd be playing a game that I made and had professionally produced, actually, called Name That Nerve. And hopefully I can figure out a way to do it online. But let's just do a little more on the cranial nerves. All right, just some factoids. Cranial nerves number 1 and 2, they're considered to be part of the central nervous system because they're the only ones that don't emerge from the brain stem. So the olfactory nerve and the optic nerve come from the retina and the optic olfactory bulb. So they don't come from the brain stem. Perhaps that's why we say they're in the central nervous system. Let's see, cranial nerve number 10, the vagus nerve, is the only one that doesn't deal with sensory or motor function of just the head and neck, because it goes down and affects your gut and your heart and all your viscera. And then some patterns. I may ask this on a test. So 3, 4, and 6, those are all for eye movements. Those are all just for eye movements. 1, 2, and 8. All right, see if you can figure it out. Those are only sensory. And 3, 4, 6, 11, 12, those are motor only. 5, 7, 9, and 10, those are both sensory and motor. 1 and 2 we already talked about, those are part of the central nervous system. And no, this one, 3, 7, 9, and 10, those are part of the parasympathetic nervous system. Now, what I will do on the test is I will give you a number or give you a name, and I'm going to ask you to know what the number, what the name is, what it does, is it sensory, motor, or both? And if you know what it does, you know what damage it'll do. So if I just say, okay, cranial nerve number 7, cranial nerve, let's count. Some say marry money, but my brother, it's both sensory and motor. 7 is do touch and feel. Facial, all right, so that's the facial nerve. It's both sensory and motor. So the facial nerve, it's going to be sensations from the face and the mouth and the nose, taste, and movements of the facial expression, and and swallowing. So know what the sensory and motor components are. And I think that's it. So we will review it more in person on Zoom, but that's the basics of the cranial nerves.